What is the number one misconception people always have about plastic surgery?
We only do hiao things.
Yes,
we are not
yeah.
trained to just do hiao things.
Yeah, yeah.
So in our early training, it is all reconstructive.
What's up, and welcome to another episode of the KopiBros Show presented by the Chit Podcast Network. Now, today, we had the very, very fun experience of interviewing Dr. Lee Hanjing, who is actually a plastic surgeon at Mount Alvernia Hospital. It's actually a very, very interesting experience talking to her, hearing her share about like what do people have misconceptions about the plastic surgery. Like we used to always think that plastic surgery means that is about what the more hiao kind of treatment according to her, right? But to learn that actually there are other kinds of plastic surgery, and of course her own expertise and her own interest, which is in the pediatric field. So she actually does a lot of plastic surgery for children. Hearing her share about why she decided to come out and open her own private practice is also something very interesting. People that want to know more about like what is plastic surgery about, what is it like opening your own practice, I think we can just tune into this episode. And welcome to another very special episode of our KopiBros Show presented by the Chit Podcast Network. Now today, we have Dr. Lee Hanjing, who is a consultant plastic surgeon in private practice and runs her own practice, Argent Plastic Surgery, based in Mount Alvernia Hospital. She graduated from Guy's, King's and St. Thomas School of Medicine in 2007 and spent most of her subsequent training in the National University Hospital. And she had completed a fellowship in cosmetic surgery at the East Sydney Private Hospital. Main interest is in pediatric plastic surgery, cosmetic plastic surgery, and also manages many other general plastic surgery conditions. So to find out more about her experience, please join me in welcoming Dr. Lee. Hello, Dr. Lee.
Hey, thanks, Jin Yong. Nice to speak to you on a Saturday.
Yes. So to give our viewers some context, we are recording this on a Saturday afternoon because I think Dr. Lee just finished her consultations on Saturday morning, right? Maybe you can give our viewers some context, like why do you have to see consultations on Saturdays?
Like it's in private practice. It's somehow half day Saturday is a consult day. Some people have surgeries done on Saturdays as well.
Oh, okay.
Yeah.
Understanding is that only A&E or like the emergency doctors work on weekends. Like all these
So in the restructured hospital, Monday to Friday is consult days, like 6 working days.
I see.
Nobody really do like Saturday clinic. But in private practice, it's quite a standard practice that half day clinics are running, surgery is running.
Yeah.
So slightly different.
I mean, because the cost is different, then the service will be slightly different also.
I mean, definitely you paying for faster service,
Yeah. Before we start, just like to check in with you, what have you been busy with recently?
Same, everyday clinic, surgeries, but now we are moving clinic location. Now I'm busy with my clinic renovations as well.
Oh, I see.
So we're just moving from first floor to the third floor. We have a new area of the hospital that got vacated. So now there's I think eight new units that will be there.
When I was doing my research, ChatGPT also said that you went on a lot of mission trips. So I would just like to invite you to share more about some of our mission trips and what you do there and why you volunteer. Yeah.
So mission trip is a very great opportunity for us to do some special type of cases that we may not have as much of in Singapore. One. Secondly, is also to help these poorer countries that they don't really have access to doctors, or they don't even have like ability to pay for it. So two countries that I've often gone in the past is Cambodia, mainly to do children with cleft lip and cleft palates. So these group of patients, they actually staying in villages that are very far away. Some of them even travel like 1 or 2 days to get into Phnom Penh, such that like they can go to that hospital. And when they come to the hospital, they have nowhere to stay. They're just lying on the grounds of the hospital. Like really very poor thing. No money to even buy food. So we even have to cater, some simple food for them. The hospital staff will buy, and then we just cover these costs because they really have nothing. Very poor thing. The other place that we go to, now obviously a bit challenging to go to, is Myanmar because of the junta issues. So last time when I go there, I used to do patients with like no ears.
So you volunteer with like an organization, or like is there some big organization?
All these are previously run together by this project in NUH, we run this on a yearly basis. So we go there constantly. It's win-win both ways, right?
Yeah,
because they get to benefit. And every case that you do is definitely, a way to improve yourself.
We always like to start our podcast by sort of asking our guests about their growing up story and all this. My question for you is that because a lot of kindergarten kids, at least my time growing up, now I don't know, okay? We always say we want to be doctor, lawyer, teacher when we grow up. So my question is, why do you persist with this dream and finally became a doctor?
Initially, I want to be a hairdresser. But
okay.
I've always not want to do a 9-to-5 job. It's just not my thing.
I see.
Then I do enjoy medicine. There's some family members of mine who are doctors lah. So I guess naturally, I think this was the path that I just gone into. When I was in JC in the science class, so I think a lot of the students just naturally did medicine. So I think I probably didn't think too much.
I see. Wow, that means your results must be very good all the way because it's not easy getting into medicine.
Yeah, I mean, we try lah.
I mean, my grades, I wouldn't say it's bad, but it's not at the level of I see already, I also, immediately medicine is out of the question really.
I think now it's changed quite a bit. It's no longer really just based on academic results. They also look a lot at soft skills because doctor is not really, of course your academic must be good, right?
Yeah.
But there's a lot of soft skills involved.
This is what I would like to echo on your point. I think that a lot of people, they want to help people in the medical sector. Doesn't have to be just a doctor, right? You can be a nurse.
Yeah.
Right. I used to work in AIC, so I do a lot of visits also. So I also see that as part of the medical sector also, because you're visiting seniors. Don't need to really be fixated on just being a doctor. I mean, if your grades are good enough, you can go for it, then of course go for it. But if let's say you want to help people in the sector, a lot of things in Singapore can do, especially in the gerontology industry, in the community sector, especially, is always expanding.
My granny's very old. Every day should go to the AIC type activities.
Yes.
Yeah, because you need some form of stimulation.
Yes.
Some engagement with everybody. And these are all very important parts.
My next question is, because you say some of your family members are doctors, I will presume not all are plastic surgeons. Why do you choose to become plastic surgeon?
Well, actually, I didn't really want to do plastic surgery right from the start. I wanted to do gynecology.
Okay.
When I was a medical student, when the first time I went to do a delivery, I think I got shocked because I think after that thing was out for me because I think I couldn't.
Okay.
Later on, I wanted to do pediatric surgery.
But
at that point in time, there wasn't a training spot for pediatric surgery.
I see.
And I just happened to be doing plastic surgery posting. So my boss offered me the job. So I think, somehow it just worked out.
But don't you find pediatric surgery very difficult? I read some comics that say that pediatric surgeries are one of the more difficult ones because their veins are smaller, their body is smaller, their organs are smaller.
So actually, everything is smaller. So you have to be even more meticulous. Right? And be very careful. And also you have another person to deal with, which is the parents.
Oh, yes,
right?
yes.
But now I would say maybe about 40% of my patients are all children anyway. So I think it just worked out quite well.
In a way, you also got to fulfill your dream, just that it's not directly in the pediatric department.
Yeah,
but you
so
go through
maybe
plastic,
I don't do like the inside abdominal organ issues. I just do mainly the external skin problems, which is still fine for me.
Was that because you always like talking to children?
I do enjoy playing with them. Children are very real. You see, if they like you, it's very easy. No need to go between the lines.
I see.
So it's very, very nice to deal with children.
What are some of the challenges that you face in this journey? Like your journey from being a doctor to choosing plastic surgery and then now opening your own private practice?
I mean, of course, it's a very long journey, right? From 07, med school is 02, 07, this is like 5 years. Then you train for 10 years. You still have to constantly study, take exams, write papers, especially surgery. Surgery is not easy because surgery is like any technical job that needs like an apprenticeship period. Right? The more you do, the better you get. Jewelers, they start at a very young age because they need to keep practicing, honing their skills. So even now, always advances. You can never stop improving yourself. You need to keep making sure you know what's going on, what's the latest technology, the newest method of doing something. So after a certain period in the restructured hospital, I figured maybe it's time to try something different. So that was when I decided, okay, let's just see what happens when I move to private practice.
I see. We can circle this back to this topic because I got more questions I want to ask about this private
no
thing
problem.
because I think starting your own business and working under a restructured hospital is two very different things.
Very, very different.
Yeah. Because I believe that you have traveled a lot. Okay. So some of your general comments about Singapore's medical sector, how do they compare to like some of the other medical sector in other countries, and what do you think can be improved upon?
I think, to be honest, our medical sector is really very well structured already. The standard is quite gold class, right? Facilities are amazing. The trust level, you no need to worry about, right? Everything is done well. Of course, waiting time, you cannot help. Every country will have some waiting time, right?
Yes.
There's nothing you can do about it. It's also quite well regulated. You're not going to have any rogue issues coming about. Not qualified people doing certain procedures, which you do see even in our neighboring countries. Yeah. So
saw it on the news.
Yeah. So have to be very careful when anybody is just choosing a doctor. Make sure you read their credentials well. I think in Singapore you don't need to worry at all. So that's the beauty of being in Singapore. You go to any doctor, definitely legit, right? No need to. Just whether you like that person's approach or you prefer another person. There's no right or wrong because I think everybody is very well trained. Like for me, I can only speak from where I've been. So Australia, that's where I've been. Also very well regulated. They also have got like health insurance and things. Very similar in a way. So, when I go to the mission trips, then you can see, oh, wow, actually, it's quite different, like the health is really, it's not there lah, especially for the villages outside the main city. So, I think we are quite blessed.
Have to be thankful lah. When seniors complain to me about hospitals, I always tell them two things that I think we should be appreciative of. I think number one is, in Singapore, right, regardless of how poor or how what you are, you go in the hospital, they won't reject treatment. This is not the case for a lot of countries, even for the developed countries, okay? They'll ask you for either your credit card first or your health insurance first.
And
then the second thing is, our medication and our pharmaceutical companies are actually quite well regulated. They work very well with the government. This is not the case for some big countries where suddenly there's a opioid crisis, there is like drug abuse that come from these pharmaceutical companies taking advantage. Since we have talked about some your story about growing up and like how you chose plastic surgery, I would like to talk more about plastic surgery. The first thing I want to ask is, what is the number one misconception people always have about plastic surgery?
We only do hiao things.
Yes.
We are not trained to just do hiao things. So in our early training, it is all reconstructive. Reconstructive means congenital deformities, right? Patient like cleft, lips, palate, one with no ears, abnormal blood vessels accumulating, certain deformities. So that is one. Second is after cancer, right? After your cancer surgeon takes out that part of the cancer, you are left with a hole. You are left with some problems with the function. So that's when we come in and reconstruct this entire area. So the easiest one to imagine is the breast, right? The breast cancer, the whole one side of the breast is taken out, or sometimes even both sides. It's a very debilitating thing. It affects a woman's self-confidence. Then we come in and reconstruct the breast. And then there are many methods of reconstructing a breast. So definitely reconstruction is a major part. Common day-to-day activities, burns, fall down, get a cut, right? Common things that is what we manage on a day-to-day basis.
I see.
I would say this is a big part of the surgery, my care, my surgeries as well.
I see.
Then of course another part comes in the hiao part. We do all the hiao stuff also. Okay. So then another second misconception is that because a lot of people go to their GPs who do a little bit of aesthetic treatments or go to the aesthetic doctor and do some aesthetic treatment. Then there's plastic surgeons who also do aesthetic treatment. So the difference between this is the level of training. Aesthetic doctors, GPs that do it, usually they do more superficial things, some injections, some lasers, nothing deeper than that. But when you want to be a little bit more invasive, of course, then you have to move on to a plastic surgeon because then we're able to do the more invasive hiao stuff.
Understand. This one I have to say I'm guilty of that also because the first time I heard of plastic surgeon was because of Korea, and they say that it was a gift for some Korean girls that their mothers will buy plastic surgery for them when they get to a certain age.
I hear that too.
So it wasn't until I watched some medical dramas where they talk about like how plastic surgeons work with like different like A&E doctors and all this, then I realized that that some of them actually they do things like, for example, like you say the breast gonna cut off or remove because of surgery, right? Then you have to reconstruct it.
I mean, because when you watch like in the past, like plastic surgery drama, like knit tuck, is all hiao plastic surgery,
correct,
right?
Correct.
But actually, there's more than that.
Since you're on the topic, I would like to ask you about the hiao surgery part, which is I think the more on the cosmetic side, right? What are some of the common cosmetic surgery that people go through?
So in Singapore, common eyelids, nose, breast augmentation, tummy tuck, liposuction. I think most common things that is being done in Singapore.
So what are some of the more like common reasons that people will come to you and say, I want to do this kind of cosmetic surgery?
So usually I find when the patients come to me, right, it had already been in their head for maybe a couple of years, right?
Oh, wow.
It's just, yeah, they've been thinking about it for a while. It's just whether it has materialized in them to go and find someone to talk to it about.
I see.
Because reading on Google, reading on ChatGPT now is just one part of it. But you need to actually consult somebody to see whether what your concerns is manageable surgically, right? Or what are the options to deal with it.
Okay, then in that case, right, because like you say, because you work in a private practice, right, I would think that most people, when they approach you, they will already have sort of made up their mind that I have at least maybe more than 50% idea that I want to do this, right? So is there any chance that any instances that you find yourself that I have to talk them out of it instead of talking or helping them decide to do the surgery?
This consultation is definitely the most important time because one, you get to know the doctor. The doctor also gets to know your expectations of what you want, because there will be a group of patients that the expectations is not right, not realistic. If you are being shown a highly filtered picture, or some AI generated type picture, there's no way to recreate that, right? So if it's not possible, this group of patients, you must make sure that you talk to them and understand whether it's feasible, because if not, nobody's going to be happy at the end of the surgery. Then secondly, there'll be a very small group of patients that we have to, have our spider sense out for, right? Is that they have some body dysmorphia. So you keep thinking that this part is not right, Actually, it's okay. So there's a little bit of a psychological aspect to it. So if you feel like there may be some of this that may be causing the patient to be unhappy with themselves, then maybe you need to highlight to them that, or point out gently, maybe you need to speak to a psychologist or a psychiatrist to make sure that that is not revealing, another aspect of themselves.
Understand.
And then there's also another group that is what we call the surgeryholic. So they have endless number of surgeries and never ever happy. So these group of patients, just be a bit more sensitive, to them, because it's not that they want. Sometimes they just cannot help it. But you must make sure that expectations are met. If not, then I think it's troublesome for both parties.
Do you have a memorable case that you can share with us that sort of encapsulates what you just shared about expectations, about trying to manage your client?
I mean, why I feel it's memorable, because this patient had seen quite a few different aesthetic doctors and even plastic surgeons prior to meeting me that one day. And I think a lot of the times it's just for simple aesthetic injections, right? But there's really no need for it anymore, because it's already very beautiful looking. There's no need for more. So sometimes it's just telling them not to do it. Actually spend 1.5 hours, I remember quite clearly, talking the patient out of doing it. It's totally
effort.
Too much effort. So much so that the next day I received flowers from her parents to say thank you very much. So I think that's why I always remember her, because I think the parents also realize that she cannot keep doing this. A lot of the times people just give in, because it's probably easier to give in. But maybe that's not the best thing to do. I don't want to do it's not unscrupulous. I don't want to do unnecessary things. Just because the patient wants. Because sometimes you must make sure that it's the right thing to do.
Understand.
Especially in this field of medicine. I mean, but that's my take.
must caveat, that's my take. Cover the cosmetic side. I want to move on to your interest, which is what you say, the 40% of the surgeries that you perform on the pediatric side. I think you have covered briefly about what are some of the common pediatric surgeries that you normally do about like cleft lips and all this? What are some of the other common reasons that children have to undergo like plastic surgery?
So very often, like they may have developed a lump on their skin, you know,
Oh no, okay.
or they may have been born with a lesion on their skin, which may be a very big patch. I'm sure you've walked
Oh,
around, you
okay.
see some kids with a huge big patch of
Yes.
pigmented lesion, maybe on the face, on
Correct.
some parts of
Yeah.
the body, some even growing hair. If you leave them long enough, if the size of the lesion is sizable enough, there's always a small risk that in the future they can turn into some form of skin cancer.
Oh no, okay.
So, like for this group of patients, definitely the earlier you remove these lesions, the better it is for one self-confidence of the kid.
Yeah.
Second is also reduction in potential cancer risk in the future, skin cancer risk lah.
I
So
see.
this is definitely one
see.
part. Then some of them, you know, they just born with abnormal connections of blood vessels, so they can get
Oh.
a huge lump. When you run your fingers through them, you can even feel the movements of the blood supply. So this is another aspect, you know, that kids sometimes have.
You also briefly touched on this just now, which is that because pediatric surgery, you don't just talk to children, right? You have to talk to the parents as well.
Yes.
Right. So
Yes.
what is the challenge as compared to like dealing with pediatric patients as compared to like your other patients in probably cosmetic or other normal consultations?
Yeah. So when the child first comes into the clinic, right, they are scared already. No children like to see doctors.
I see.
Right?
Okay.
So for me, what I like to do is the first thing is you must squat down to the level of the child. So I'm at their eye level, right? So they don't feel threatened by this stranger that is sitting on a chair. Then next thing I do is I start playing with them first. No talking about why they come into the clinic for. Because the child doesn't know who you are. You need to gain a bit of trust. So that's what I like to do. I spend a couple of minutes talking to them, you know, understanding. Sometimes a little bit of bribery lah. We give some candy. Some not pediatrician. They're not sick. Okay, so some candy, biscuits,
I see.
tattoos. You know, like just so that they feel a little bit more comfortable with you first. Then it's much easier for the whole thing to proceed on. If not, some of the children, they may just start crying because then it's very hard for the parents to move on and talk to you because
I see.
half of their attention is on the kid already.
I see.
So I mean that's how I like to approach kid. I mean, these are usually, you know, maybe younger than 6-year-old. The slightly older kids are not easier lah. You know, you can just talk to them like an adult.
Okay, then how about the parents? Like, do you have to communicate any differently as how you communicate with other patients?
No. So for me, parents or like adult patients that I talk to, they're still a patient, right? It's just that their perspective of the event is for their kid.
I see. Okay.
As long as no matter what type of patient, you need to describe in great details like what's the surgery done, right? How we're going to do it. What is the recovery? What is the complication potential? No, like all this must be clearly mentioned lah. And for me, I find that I always draw. So when you draw, it brings their attention to the thing a bit clearer.
Oh, okay.
So I
True.
think that helps lah. Yeah.
So we are not focusing on you and me. We are focusing on the drawing and talking about the drawing and the subject there.
Yeah, it's probably easier. So then the kid already maybe felt a bit comfortable.
Can you share with us a case that's very memorable from your pediatric plastic surgery cases that you did? Yes.
Actually, just maybe quite recently. So this parent, the kid had one lump here, pigmented lesion here. So I already saw 2 previous dermatologists for lasers. But of course, a young kid cannot tolerate laser like an adult. So to do that, you either have to give them some sedation, but we cannot give sedation to children in the clinic. You know, it's not allowed because for safety reasons. So unless you bring them to the operating theater, which is like an overkill, right?
Yeah.
So then the parents are getting a bit concerned about that treatment option. So, and then second thing is they say that even their older son kept asking about it. So they start getting very conscious and worried that that kid next time will face this kind of judgmental eyes. So when they first came, a lot of the times this kind of conversation takes long, right? Because the one parent may be crying because they're really very emotional. Like a lot of things had happened already in the past couple of months. So it sometimes this kind of conversation, like I remember this kid very well because it took 2 or 3 consultations before they came to terms with it. But once they come to terms with it and the surgery is done to remove the lesion, they're very happy. because
Oh, that's good.
they
That's good.
saw
Yeah.
the solution is given, despite, with an exchange of having a small scar, they accepted it. Once again, is expectations, right? Like try to
Yeah.
manage
Yeah.
it.
Yeah.
That's why I always
Yeah.
remember this our parents, because from a very resistant to being happy about it, and then later the mom said, like, now at least I felt something has been done. I mean, that's why I remember them quite well now.
Yeah. I think this is a very nice and heartwarming case. It's not about like 你嫌弃他们长得怎么样. It's that sometimes you go out, you cannot control how people look at them. Or like they go to
Exactly.
school, then some of the younger students or younger kids, they cannot control lah, right? Because they are not that trained yet. Yeah.
And
So
because
difficult
children,
lah. Yeah.
they are very honest, right? They
Yeah.
just say
Yeah.
they don't
Correct.
mean any harm, because they're not going to
Correct.
sugarcoat their
Correct.
words, right? I think that's what the parents are trying to do for their kids, to give them a better head start.
Or else it will keep piling up, and then you will not be that healthy lah for growing up, for kids growing up journey.
Yeah, it's like the confidence level, you see.
Yeah.
Like,
Yeah.
so sometimes that's why I find that this job is pretty meaningful, sometimes more than the hiao
Of
ones.
course. Yeah.
Yeah.
Yeah. Because I also want to be able to use medical fields to change people's life, but cannot lah. Yeah? I only can talk to people, visit them, this kind of thing. Yeah. Let's move on now to my personal interest, which is like, why do you decide to come out and open your own clinic instead of staying in a restructured hospital?
Restructured hospital. Yeah. Okay. So I guess at that point in time, I was already like almost 5 years after I finished my exam. So like 5 years as a qualified plastic surgeon in the restructured hospital. So the type of cases that I'm doing there maybe became quite similar, quite standard.
Understand.
And then in restructured hospital, you don't get to do the more hiao aspect, because nobody really goes there to do that kind of cases, right?
Yeah.
So I thought maybe just for my own personal
growth
evolution, I also need to do a little bit something different. At that point in time, I turned 40. So I thought, okay, let me try something at the change, the age gap, the age bracket. Then the opportunity also happened to arise in Mount Alvernia, where I wanted to be. So
I see.
That's how it is.
Oh, interesting. Okay, then my next question I want to ask might sound a bit sensitive to you, but if you think it's not sensitive, you can answer lah. Okay, because we interviewed an intimacy therapist before, who's also a doctor, and she said that she opened her own clinic, but her own clinic is not like under any like hospitals ma. So for her, one of the biggest challenge is always money, how to get clients in, how to keep the bills coming in, right? But for you working under Mount Alvernia, is it easier, like in the sense that you don't have to go out look for clients because there's Mount Alvernia, then there's some form of profit sharing, I guess?
Yeah, so we are not employed by the hospital.
I see.
We rent the clinic units in the hospital.
Oh, okay. I
but
see.
being in a proper hospital, there will be like certain emergency cases that we help them manage, right? When the patients come into the emergency care. So we call it urgent care center, right? So yes, sometimes there'll be some referrals. We manage the urgent type cases. But of course, this is just a small portion of the workload. Like majority of it, you still have to do you have to raise awareness, because people may not know where you are, or until they need to solve one problem, then they start Googling and then maybe reading reviews. So that's the new thing that I'm learning lah. I'm still learning it. I'm just like about 3 years. So marketing, website, SEOs, SEM, social media. It is. I mean, we are learning along the way. It's not so easy, but it's been quite fun.
That's also why I found you, because I saw your social media, and then I saw your viral clips, which is about the breast augmentation clips about choosing the right silicone and whatnot. I wanted to ask you also, like, what are some of the opportunities or lessons you have learned, like running your own clinic as opposed to like working in a restructured hospital?
Yeah, so like now, from everything from accounting, how you want to manage the business, because you need to know I mean, before that, you don't care. You're just salaried worker, right?
Correct.
Just check your payroll at the end of the month. But now you have to order stock, make sure stock is in, see if there's any new technologies you're interested in acquiring. And then you have to manage the business awareness part of it. You have to now manage your own HR, your staff. It's not so
okay.
easy. Then just
Headache.
go to work, turn up to work, go home after work. It's not
I see.
more. And then you even clean your own rubbish. Throw the rubbish at the end of the day. I mean, of course, my staff helps me now, but like, it's just part of doing your own business, but it's just a
Yes.
small practice. So
How many staff do you have at the moment?
I have 3 staff at the moment.
Okay. 够了，
Yeah.
也是 difficult. Yeah.
Just nice.
So I always find it a very interesting thing that doctors that open their own practice like come out and do social media lah. So why do you decide to come out and do social media and like post clips about your practice or like just educating people?
Yeah, because personally I like looking at IG because I think it's just very
Okay.
well, like beautifully created
Okay.
post, right?
Okay.
So then of course it's a very direct way of trying to gain some traction and some awareness. And the process is pretty fun, right? Like film a video, come up with some ideas. Your content creator will help, edit the views and then and then slowly you gain a bit of traction. Then actually, it's quite fun. Then you end up just keep doing it lah.
I mean, I've also interviewed people that say that, like, for example, I interview a housing agent that say that his Instagram is how clients trust him because the clients can see that, this is his way of understanding trends. This is the way of like telling people that, this thing is coming up, this kind of thing. So they see that as a form of gaining trust also lah.
I think consumers now, patients, right? Very aware. So, you would look at website, you would look, maybe social media, you would look at reviews. You go
correct.
restaurants, you also look at reviews. So all these things are just part of it. The more, legit you are, the better the patient will trust you also. And then of course, coming into the clinic, if they don't trust you, they won't come into your clinic. Right? Because there's so many options.
Right.
So after coming, if you have a different persona on the video and a clinic session, they will also like just go away, I find.
I'll try to ask you a very kaypoh question, which is, what does one day in your clinic look like?
Wow, okay. Like today, I started work at 7:30.
So early?
Yeah. Because that's the only available OT slot, operating theatre slot the hospital can give me. So started at 7:30. Then because it's Saturday, right? So we finish clinic. We're supposed to finish at 12:30 lah, but we finish about close to 1 o'clock.
1. Yeah.
Yeah. Then, but if it's on a maybe full day, then we probably end about like 5, 6 o'clock. Depends. Some days would be running clinic. Some days would be, in the operating theatre.
Okay. So do you have to like block out, for example, Tuesday is whole day operating or Thursday is whole day operating?
No, for me it's more ad hoc. You're not given a fixed slot. So whatever comes in, we just arrange accordingly.
I hope you have a PA to help you manage this because it's not so straightforward. Yeah.
Very good.
Okay, can. Yeah. Wow. I can't imagine if you alone manage all this Google Calendar will die.
It's not possible. Cannot. Yeah.
So let's now talk about some of your future plans. What are some of the interesting projects that you can tell us about moving forward?
So definitely one is the clinic renovation.
Okay.
I can't wait for that new space to come out because it would be hopefully a space that, what reflects me lah. As an individual and the philosophy of the clinic. So that's one thing. It should be up by November, hopefully.
Okay, that's nice.
Then and we are more settled, then look into like more technologies that we can bring in to the clinic.
Okay.
I think step by step, because now my focus is mainly just sorting out the renovations.
Yes. One thing at a time.
And because this is my 3rd year in private practice, so hopefully by the time I get into more of a stable swing with the new clinic location, then I can resume once again the mission trip works lah.
I see.
Hopefully next year or the following year when.
My next question is actually very related to what you just mentioned, which is that new technologies, right? How do you learn about it and how do you decide like, okay, I think this one we should take it into our clinic and try it out?
The vendors will usually come promote to you like new products, right?
Okay.
Then is either myself or my girls, somebody would try. If you don't try it, you don't know it, I'm not going to get it. Because these are huge investments, right? And if they're not going to give results, then why do I want a white elephant sitting in the clinic?
True, very true, yeah.
Yeah, so it has to work. So everything that I do on my patients, I've tried it on my face or my body or whatever. I've tried it with If not, I will not be able to explain or tell you that yes, it works. No, it doesn't work. I also don't want ineffective products.
Oh, okay. Then I was mistaken because I forget that because yours is plastic surgery, deals a lot with the skin and the outer. That's why some of the products you can probably try on your own. Now I was thinking something like, I don't know, AI generated surgery, that this kind of cutting edge technology, then you need to try out. Know how you want to try before you adopt.
For me, maybe a bit different. My focus, so like maybe new laser machine, new injectables, or along those lines. Yeah.
Okay, so because of your field, that these are the things that you can try out lah. Don't need to say like, we trial. Let's say we trial, I don't know, on 100 patients first, then before deciding to roll this out.
And no need 100 patients lah. You know, you at least you try amongst yourself, because usually if you look at the brochure before after picture, I sometimes don't trust it because it can be Photoshop, right? So
true.
Until I see it self,
I see.
I think it's legit. Then I will use it.
Mm-hmm.
I think the main thing that more people are talking about is, I would say, is this regenerative medicine, right? Anti-aging medicine. So what we are trying to do is not to, when you are 70, then do a facelift, you know, to make yourself look younger. At this age, when you're in your 20s, 30s, 40s, so little things that you can do to slow down aging. And it's not just eating certain medicine. It's not just injecting certain things. It's just, I think, a way of life, you know, how you approach aging. You know, we all age, right, by the minute. So these kind of products that helps to maintain certain viability of the cells, you know, within your face, your skin. I think this is the newer emerging market that more people are interested in right now.
Before we end our interview, we will do a round of quick-fire questions. First question: what is your favorite song to start the day?
No one fixed song. It can be depending on my mood. Jazz songs, classical songs, Chinese songs, anything lah.
Oh, okay.
Anything.
Can.
Yeah.
Most memorable patient?
This one little kid, that day the mommy just sent me a picture. So of him wearing a surgical scrub. So he said,
so cute.
You've inspired him to want to be a surgeon next time. So I always remember this little kid.
So cute. Okay.
Yeah.
Adult or child patient?
Child.
Oh, okay. The most challenging case you have handled?
Too many. Cannot
okay.
give you one.
Okay, sure. Most important quality to be a plastic surgeon?
No most, you know. I don't think it's just one. It is, there are a few lah. I think you have to have a very good eye for beauty.
Oh, okay.
Yeah, because it's an appreciation, right? You have to be very meticulous, a little bit OCD. Yeah.
Okay.
And then you have to be thorough lah, you know.
I
think these are very important skills.
Okay, last question. Favorite way to unwind after a long day?
I think I just want to lie in bed and noir. It's true.
Okay. Yeah, as like all of us lah. It was really a very awesome episode and very fun episode to get to learn more about your career and your job as a plastic surgeon. But before we go, do you mind letting our audience know where they can find you?
Once again, I'm Dr. Lee Hanjing. My clinic is Argent Plastic Surgery. So Argent is the word silver in French.
Oh,
so
wow,
because that's my philosophy, right? So we hope to create a silver lining in people's life. So
wow, okay.
Yeah, that's the philosophy behind it. And we are at Mount Alvernia Hospital. So in the next few months, you'll find me in the 3rd floor.
Thank you so much for your time, Dr. Lee, and hope you have a great week ahead.
Yeah, thanks, Jimmy.